So we're in week 8. So we are covering appendicular skeleton and articulations this week. We covered axial skeleton last week. And we'll have your exercise 7 homeworks due this week, as well as we're going to have quiz 3 over axial skeleton. What we did last week, we'll have that quiz on Thursday. So basically you'll have 25 questions, you have a word bank, you'll be looking at pictures and identifying, bones, structures on the bones, whether it's, parts of the axial, axial skeleton, obviously, bones of the skull, and landmarks on the skull, structures of the skull, sternum, ribs, vertebrae. So that's what that'll be over. All right, let's see. So let's go ahead and switch. So last week we covered the axial skeleton. Remember there's 80 bones there. This week we're covering appendicular skeleton. So you have 126 bones. So you have the pelvic girdle, the upper limbs, the pelvic girdle, and the lower limbs. In pelvic girdle, you've got 2 clavicles and 2 scapulas, one on each side. For the upper limbs, you have a humerus, radius. So if you're in anatomical position, the radius is on the side that your thumb is, and the ulna is on the side of the other phalanges. And you have your 16 carpal bones in the wrist, and well, essentially, you've got your metacarpal bones in the wrist and your phalanges. In your pelvic girdle, you have 2 hip bones. In your lower limbs, you have your femur, patella, tibia, which is the larger bone, fibula is the smaller bone, the tarsal bones in the ankle, metatarsal bones in the foot, and the phalanges in the toes. Okay. So that's basically an overview of the appendicular skeleton. So let's start with the clavicle. In each box, you should all have a box at your table. You can open that box up. If your box doesn't have a clavicle, then you can check the skeleton. Skeletons all have a clavicle. So clavicles, it looks kind of like a rib, but it's not. Kind of an X-shape to it. On the lateral end, you've got a acromial end, touches the acromion of the scapula, and the end that is medial touches the sternum, so it's the sternal end. Okay, so then the question is, how do you know if you have a right clavicle or a left clavicle? So let's look here, rules for right and left. Let's see, scroll down to, there's clavicle. So you're going to point out the flat sternal end toward the midline. The clavicle bulges out and then in. And the coronal-tubercle must point down. So main thing is, you point the flat sternal end toward the midline. It's got to go out then in. And that will tell you which way it is on the scapula. So all right, so here's the sternal end of the clavicle. It bulges out and goes in. So let's tell you the left. It bulges out to the lateral end of the face, or the left side of the body. This one, sternal end here, bulges out and in. So the acromial ends facing the right side. So that's how you tell whether it's right or left. And you'll get 1 or 2 questions. You don't necessarily have to worry about this for the quiz, because again, the quiz is just on axial skeleton. But for the exam or the practical, you'll have a couple of questions they'll ask you, is this left or right bone? All right, so for the scapula, we got a few different structures you need to know. So the kind of big portion of the scapula is the body, kind of big open space. This point up here, if you're on the posterior view, you've got this spine. So that's how you'll know you're on a posterior view if you see this big spine across it. Remember, posterior is toward the back. And then you have this big space here. That's your acromion. That's where the acromial end of the clavicle is going to touch. All right, so on the underside of the spine, you have the infraspinous fossa. On the superior side, or on the inferior side, you have the infraspinous fossa. On the superior side, you have the supraspinous fossa. And a fossa is basically kind of a space. This line here at the top of the superior end of the scapula is the superior border. Here's a view of the coracoid process. You'll see it better on the anterior view. Okay, this is the lateral side of the scapula. So this is the lateral border. This is the medial side, so it's the medial border. So looking at the anterior view, then this is the medial border, and this is the lateral border. All right, so this is the scapular notch, this little ridge. Big point here is the coracoid process, and you can see the acromion back here. This space here is the subscapular fossa. Below that scapular notch, you're looking from a lateral view. So if you were to take the posterior view and turn it, so you're looking at the side of the body, the socket of the ball and socket joint is your glenoid fossa. And you can see a bit of the spine, some of the acromion, some of the coracoid process. So does everybody have a scapula? So that is a hip bone, octal bone, bone. Okay, that's scapula, that's scapula. Yes, that's a scapula. You don't have one? Okay, good. So I'm going to show you how to tell right and left for the scapula. It says hold the bone with the spine facing you. So find the spine of that scapula. Make sure that spine is facing you. And the apex points down. Okay, where the lateral medial borders come together. If the acromion faces to the left, it's the left scapula. Okay? And if the acromion faces right, it's the right scapula. So, all right, where we go? All right. I want to. You have two scapulas in your body. do as well. Okay. You do as well. All right. What about you? The parent coordinates to the conservation. The strongest facing to the left. Yeah, you got it. Yeah. So the spine's facing you. Actually, spine facing to the right. Or the tongue is facing to the right. So it's to the right. All right. So I'm going to give you a couple of minutes. Look up, try to find as many of those structures on the scapula as you can. So I'll give you a couple of minutes to find this. Yes. So turn it around. No. Yes, it's like that. Spine facing to the tongue is facing to the right. So it's the right. So we look up here. It's the same as this. So the spine faces up here. So it's where your shoulders are. Axial, yes. No, just axial. Yes.
I'll assume it's going to be skull, right?
There'll be a lot of slope. All right. All right, so let's go on to the humerus. So for the humerus, structures you need to know. You need to know the head. All right. So opposite the head, you have the greater tubercle. Let's see it right here. All right, you have the lesser tubercle, which is kind of a little button there. So you can see the lesser tubercle kind of in between the greater tubercle and the head, or intermediate. Running kind of in between the greater and lesser tubercle, you get this little space. We call it an intertubercular groove. All right. So along this view, you've got a little space here. We call it a coronoid fossa. Okay. Space. Lateral to that is the radial fossa. And it has some articulation with the radius there. So then you've got this space here we call a condyle, made up of a trochlea, which is more pointy, and a capitulum, which is a little more rounded off. Also here you can see a good view of the medial epicondyle. Here's another view of the trochlea. And remember, it's pointed kind of. And here's the lateral epicondyle. And on this side, you see the olecranon fossa, which is a structure on the ulna. So it's where it articulates with the humerus. So I will give you, let me show you on for that left and right. So for the humerus, you hold the bone so the capitulum and the trochlea face you, and so you're looking at the anterior view. And if the head faces to the left, it's a left humerus. Okay, so this is the anterior view. And so if the capitulum and the trochlea are facing you, and the head of the humerus faces left, it'd be a left humerus. If it faces right, it's a right humerus. Okay. So what do you think you have? So this is the anterior view of the head. Okay, these are capitulum and trochlea. So head of the humerus is facing the right. This is the right.
Oh, yeah.
So on this one, the trochlea are here facing you, but the head of the humerus is facing to the left. It's not as big as So you get the big dip. Okay, so let's just do the skeleton. So the anterior side, this one facing you. You've also the head of the humerus is facing to the left, to the left. And this one is facing to the right, Okay, so even if you didn't have it connected to the body, I showed it to you. You see this, you see this direction. All right, so on the posterior side, you should all see a big depression at the bottom. That's the olecranon fossa. That's where the olecranon sits. big hole there? No, that's the posterior side. That can help you kind of know which way is the front, which way is the back. So you definitely need to learn your structures, and you have different fossa, epicondyles, the trochlea, the capitulum. There's just no substitute for time on that. Also, I think I have some practice anatomy left, or some purpose games that you can play. Also, practice anatomy lab in mastering is really good for this as well. And the bones we'll have bones in the concept lab that you can look at as well. All right, so let's go to the radius and the ulna. These are the bones in the forearm. All right, so that should say process. All right, so this hole, this big curve, and it's the trochlea or not. So your ulna. Why? Because it articulates with the trochlea of the humerus. Okay. Bottom point of the trochlea now, Coracoid process. And the side of the notch there is the radial notch because it articulates with the radius there. Okay. Up here, ulnar tuberosity. So if you're trying to figure out which one is which, you see the curve, that's your ulna. And it's also longer than the radius. The radius has a flat top. Ulna has a curved top. On the inferior end, you have an ulnar head, has a bump there, and then you got a little point which we call the styloid process. Okay, so it should be, ulna should be pointing at the inferior end. On the radius, has a flat head, radial head, also has a bump here, we call it the radial tuberosity. So the radial tuberosity and the ulnar tuberosity kind of come together. And you also have a point on your radius on the inferior end, so you have a styloid process there as well. Okay. Okay, so for radius and ulna, for ulna, if you face the trochlear notch, face the C away from you, and you look at the ulnar cranium, you ask yourself what side is the radial notch. It's on the right, it's the right ulna. What's on the left is the left ulna. And for the radius, you orient the bone with the round head up and the distal end down. Look at the bumps on the distal end, look for the styloid process. If the styloid process is on the right side, it's the right radius. Styloid process on the left side, it's the left radius. So for the ulna, you're looking for the radial notch, and for the radius, you're looking for the styloid process. Again, we're talking 2 questions on the practical, so don't stress out about it if it doesn't make sense. So I'm going to give you a few minutes, look up these structures on the radius and the ulna. Also on pages 190 in your lab manual through 193, you can also be labeling if you want to label those structures as well. You have your lab manual. So you got ulna and radius. So you might want to make sure you do Flip it over. That's the head. So for the ulna, we do it radial knot. So, all right, so it's on the left. So actually for the not for the ulna. Yes. For the radius is for the clavicle. Basically, the shoe will go toward you. So like, solid process. But like I said, the left and right is not as important as knowing the different structures. Okay, because you'll have a lot more questions about structures than you will left and right. Okay. All right. So let's talk about the hands and the wrists. So these are the bones of the wrists. I'm going to skip over to the phalanges and come back to the wrist. So in the phalanges and the metacarpals, so basically you're going to number these 1 through 5 for the metacarpals. Okay. Roman numeral 1 for the thumb, Roman numeral 2 for the second finger, Roman numeral 5 for the pinky. All right. For the phalanx or phalanges, your pollex or your thumb has a proximal and a distal phalanx. Your other fingers have a proximal, middle, and distal phalanx. Okay. So if I were to have a sticker here, you tell me this was it's a proximal phalanx because it's closer to the base of the hand. Okay, this would be a distal phalanx. This would be a or middle phalanx. Yeah. This would be a the proximal phalanx because there's only 2. Well, this is, I'm sorry, we're on the pinky. So this is a middle. The middle. This is the proximal. This is the thumb. So You didn't see that. We'll go to this one. This is a distal phalanx. This is a proximal. Proximal. So there's no middle on the top. Okay. So, and if I'm pointing up here, I'm going to point to this one. You tell me this is. Well, what type of bone is it first? It's a metacarpal. What number? Number 4. Okay. It's 4th finger. Okay. This one would be metacarpal 1. Okay. Roman numeral 1. Okay. So the bones in the wrist, the carpal bone. So if you start essentially up at your wrist by your side just on your thumb, and we make a circle and go around. You have scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, trapezium. Okay, a bunch of big words, I know. So, all right, so here's how we try to help you remember. Create your little mnemonic device. So long the pinky, here comes the thumb. And essentially you're going to, all right. So essentially if you take your hand, it's just like turning your hand like this. So in this terminology, A is your scaphoid, B is your lunate, C is your triquetrum, D is your pisiform. All right. H is your hamate. All right. So yeah, G, capitate, F, easy, trapezoid, trapezium. Okay. But the rest kind of orient yourself. P, the pisiform. P is on the thumb side. It's so long the pinky, here comes the thumb. Scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, trapezium. So here's the way they, in your lab manual, they say so long top part, here comes the thumb. Okay. But again, you're starting out on the thumb side, so long top part, and part of it is the T and the P, like the P kind of comes over the T. So just kind of keep that in mind. All right. So I know it's going to take a while to kind of learn that, but if you have a hand in your box, use that. If not, use the hands on the skeleton. I'll give y'all a minute to do that. along to pinky. So, all right, so let's talk about the lower limb. So the pelvis, your coxal bone is really, our os coxae, is 3 bones fused together. So the ilium, which kind of forms the big portion of your pelvis or spine of your pelvis, pubis, which sort of faces anteriorly, and the ischium, which faces more posteriorly or laterally. You can also see the sacrum here in the coccyx there. The space in here is your pubic symphysis, right? We learned about that in lecture with our articulations. All right, so here's looking at individual bone. Again, here's a view of the ilium, ischium, and pubis. Remember, pubis faces anteriorly. Ischium is more posterior. All right, this whole big crest here is your iliac crest, because it's on the ilium. Okay, so these points are sides of the crest are iliac spines. This is on the front side, and it's sort of the upper portion of the spine, so it's anterior superior iliac spine. Back here, you have the posterior superior iliac spine. Okay. Now, under here, it's below, so it's anterior inferior iliac spine. And down here, anterior, so you have posterior inferior iliac spine. I know there's a lot of words in there, but just look at it based on where it's at. Okay, so here you have a superior iliac notch and an inferior iliac notch. This big notch is your greater sciatic notch. All right, so the socket for your ball and socket joint is the acetabulum. This point here is an ischial spine because it's on the ischium. This little notch, smaller than the greater sciatic notch, so it's the lesser sciatic notch. All right, big bump here is the ischial tuberosity. This big space here is the obturator foramen. We'll learn more about that when we get to the muscular system. This part of that circle area at the bottom, we call the ischial ramus. Okay, this part of the pubis, the large part, it's the body of the pubis. Point is the pubic tubercle, and this line on the top of that point is the pubic crest. So, and I would say on the hip, I mean, I can go back to the form, but what I would tell you is find your acetabulum, find the ball, or find the socket, okay? Socket's always gonna face laterally, right? Because that's where your femur goes in there, right? For your ball and socket joint. Pubis has to face front. And so based on it being to the front, if you orient yourself, okay, pubis is front, ischium is or is posterior. So if you then you would I would say turn it so that the ischium is facing you. If the acetabulum faces to the right, it's a right os coccyx. So like with yours, okay, so you've got the ischium facing you, okay, acetabulum facing to the left, and to the left. Okay, so you, okay, acetabulum facing to the right, so you facing to the right. Not for the foot. The foot is all natural, but you wouldn't have to know all the parts. All the none of that stuff's created. That'll be on practice. So everything today was on practice. What we did last week. Well, that's a bad one. Yeah. So I would use this is your issue. I'm going to this part. Yeah. So then if you're at the tablet, it's on the right. That's right. All right. So looks like we got both. I agree with that. So, all right, so hold it like it would be in. Yeah. Right.
So like example with this articulation, like what type of angles you said some type of muscle tendons run through
Obturator foramen, yes. Yes. Go ahead, Trip. Huh? It would be not this Thursday, following Thursday.
And then this Thursday.
Correct. All right, so this is just showing you on the medial side what it looks like. So there's your pubic tubercle, pubic crest, the ischial ramus. There's where your pubic symphysis is. Your lesser side notch, greater side notch, your ischial spine. Okay, your posterior inferior iliac spine, and your posterior superior iliac spine. On the medial side, you get a big view of the iliac tuberosity and the iliac fossa, this depression. Another view of the iliac crest. Here's your anterior superior iliac spine, your anterior inferior iliac spine. Okay. So that's just what it looks like on the medial side. Okay, let's look at the femur. Largest bone, body. We have a head and a neck. Does it make sense? Following this line down to the neck, here you've got the greater trochanter. On the medial side of your femur, you have a lesser trochanter. So greater trochanter is on the lateral side, lesser is going to be on the medial side. Now along the opposites of the femur, you run down, you should see a kind of a line that forms along. Call that linea aspera. So on the anterior surface, so you know it's the anterior surface because you have it's more flat. Posterior surface, you can really see the medial and lateral condyles. Okay, it's two kind of separate little spaces there on the posterior surface. All right. On the anterior surface, your patellar surface, where your patella articulates with your femur. Your lateral epicondyle. On the inside or medial side, you have a medial epicondyle. So they're a little bit more superior than the condyles. Condyles are more distal, okay? Epicondyles are more proximal. Lateral condyle, medial condyle. Now, if you flip it and look at the posterior surface, you see the medial condyle and lateral condyle. And the space between the condyles is the intercondylar fossa. And just like, I don't know if you remember body regions and landmarks, the anterior surface was patellar, posterior surface, popliteal. Okay. So I'll give y'all a few minutes to locate those. Yes, the intercondylar fossa. If you see that, that's the posterior side. So telling right from left on this, essentially, to me, like personally, I would look at the distal surface. So particularly, if it's easy to see the lateral medial condyle, and then so at that point, I would flip it around, because then you know this is your anterior surface. Okay. If your neck, or if your head points to the right, it's the right femur. So it tells you here if the head must face in, the lesser trochanter must be on the back side of the bone. All right, so let's looking at it based on the trochanters. I mean, personally, I would look at it based on the condyle. Yours, yeah, so this is this anterior surface, right? So your left. So yours. So Anterior. So because your head of your femur is facing to the right. Let's see. So, the anterior surface. Head facing to the right. Doesn't look like it's facing the direction. All right. Just remember facing left, facing right. When you look at it like this, you're like leaning on the left side. You have to remember facing this way. I'm not. Yeah, I will say if it's on something, yes.
Oh,
Well,
we wouldn't be able to.
no, you won't be able to do that. Nope, keep touching.
That,
Some will be bones on the table, some will be skeleton. Okay, here's your patella. This is one of the more complicated bones that you will see on your test, right? You got a whole lot of structure that you have to know for this patella. So for the patella, you need to know it has a base and an apex. Okay?
this is what we don't.
Yes. So you know more of the flat on the more superior surface. The base, more pointed in, more distal in is the apex. All right, let's move on to the tibia and fibula. So on the tibia is the larger of the two. To me, I also kind of help myself by saying the tibia kind of forms kind of like a T in terms of its structure. Tibia has to be big because it has to hold the weight of the body that's being passed down to the femur. So with the tibia, what do you need to know? Well, remember, this is medial, this is lateral. So this is the medial tibial condyle and the lateral tibial condyle. This bump here, tibial tuberosity. So this line along the diaphysis of the tibia is the anterior crest. All right, now on the distal end, this is the medial side, so you have the medial malleolus. Now the fibula has the lateral malleolus. And this surface on the distal end is called an articular surface. Why? Why do you think it's called articular surface? Because it articulates, right? With your, what bones? The bones in your ankle, the tarsal bones, right? All right, and on the fibula, you need to know it has a head. So a head and a lateral malleolus. Now this space kind of between the tibia and the fibula is your interosseous crest. Now you also have articular surfaces on the proximal end of the tibia. Why? Because it's articulating with the, what's the tibia articulating with right here? The femur, right? Bone we just studied. Now, because you have a condyle here and a condyle here, you have a space in the middle. We call that, and it's raised up, so we call it an intercondylar eminence. All right. Yes.
Where does the collarbone?
So your patella bone, essentially near where part of the tibial tuberosity. So, because it's going to touch both the patellar surface, mostly the patellar surface of your femur. So it's mostly in the feet. Okay, so you get some there from tibial tuberosity, but mostly on the patellar surface of your feet.
That's the rules.
So you, some bones may not, like here's one right here. Here's one, like this, two. Yes. Technically is. I'm not gonna bother you with that. All right, let's look at the foot. So the foot got the calcaneus bone, or calcaneus bone, depending on how you pronounce it. Tails. Two large bones. The tarsal area. Now this kind of square looking bone is the cuboid. All right. Well, on the medial side, we have the navicular. And you have three cuneiform bones. Okay? You have lateral, intermediate, and medial. Right? Because this is your metatarsal one, so this is where your hallux is, your big toe. So this is medial. So relative to the hand, bones of the foot are a lot easier, okay? So the main thing is if you know these four, calcaneus, talus, cuboid, navicular, then you just kind of have to know the name cuneiform and know whether it's going to be lateral, medial, or intermediate. And we put Roman numerals for our metatarsal bones. Just like in the hand, your hallux has two phalanges, proximal and distal. Your other toes have three, proximal, middle, and distal. Okay. So I'll give you a minute to look at the structures of the or bones of the foot. All right, so let's talk a little bit about articulations. So again, we can describe bones based on functional and structural classifications. So if there's no movement, it's synarthrosis. There's a little bit of movement, it's amphiarthrosis. Lots of movement, diarthrosis. Under synarthrosis, and actually before we get there, if you want to describe bones or joints structurally, they can be fibrous, cartilaginous, bony, or synovial. Okay, so under fibrous, under synarthrosis, you have the suture, which is fibrous, and the gomphosis, which is fibrous. So under sutures, you have those in your skull, right? Like the frontal suture, coronal suture, and gomphosis holds your teeth in place in your jaw. Cartilaginous joints, you have the symphydosis between your clavicle or your ribs, between your ribs and your sternum. You have a synostosis, etopic suture, frontal bone. Under amphiarthrosis, you have a syndesmosis. And between the tibia and the fibula, you have the symphysis, which is cartilaginous, like the pubic symphysis. And synovial joints, which are your diarthroses. Okay, these are like your shoulder joint, knee joint, elbow joint. All right. So under that synovial joint, we can break them down into different types of joints as well. So between your C1 and C2, your atlas and your axis, cervical vertebrae, you have a pivot joint. Allows you to turn your head. Okay, yep, say no. In your shoulder and your hip, you have ball and socket joints. And between the radius and the carpal bones of your wrist, you have condyloid joints. Between your carpal bones and your first metacarpal bone for your thumb, you have a saddle joint, your elbow joints, hinge joints, as well as your knee joint. You also have plane joints between your tarsal bones and carpal bones. You have plane joints there. So all right, so I'm going to point a few areas. So what type of joint is this? Hinge joint, right? What type of joint is this? Ball and socket. What type of joint is this? Saddle, okay? What type of joint is this? The wrist. Plane joints, okay, bones in the wrist, okay? Now, here, what type of joints? There are other fingers. In the base, and other fingers. Condyloid joints, okay, my neck. Pivot joint, okay? All right, and this just kind of gives you more information about that. It's in your lab manual. Okay. Again, the condylar joints are biaxial, so you can do flexion and extension or adduction, which we'll get into in a minute. All right. Extension, moving your head back toward anatomical position. Flexion is reducing the angle of the joint. Extension is increasing the angle of the joint, going back to anatomical position. Hyperextension is extending past that point of anatomical position. Okay, same with hip joint. Flexion, decreasing the angle. Extension, increasing the angle. Hyperextension, going past the anatomical position. Same with the wrist. Flexion, extension, hyperextension. All right. If you're going angular wise, going away from the midline, abduction, back toward the midline, adduction. Same with your wrist. Abduction, adduction. Same with the feet or legs. Yeah, abduction, going out, adduction. Same with the fingers, abduction, adduction. Going around in circle with your shoulder joint, circumduction. Yes. I mean, it's a combination of all of these. Okay, if you turn your head, you have some lateral rotation, same with the shoulder joint. Leave out, lateral rotation, medials in. With the hands, anatomical position is here. You turn them over, you pronate. Turn them back, you supinate. Pronation, supination. Pronation, supination. All right, moving your ankle in is inversion, out, eversion. Digging in your heels, dorsiflexion. Staying on your tippy toes, plantar flexion. Using your thumb, posing your fingers, opposition. Moving your jaw out is protraction. Moving it back in is retraction. Moving your jaw down, depression, back up, elevation. Okay, turning your neck to the side is lateral flexion because you're decreasing the angle and moving laterally. All right, so your knee joint, what we do want you to know about the knee joint, you see these different ligaments. Here's your patella. You have your ACL, you guys ever heard of that, or anterior cruciate ligament, posterior cruciate ligament. Okay, on the joint cavity, or joint synovial joint, here's your articular cartilage. So it's cartilage where those bones touch each other. It's your synovial membrane. It's a lining here of the joint cavities, your synovial membrane. The joint cavity has synovial fluid in it. Lining of your bone, periosteum. Remember, here's your spongy bone. Here's your medullary cavity, kind of going back review. There's your compact bone here on the outer end of your bone. But you should definitely be able to look at a picture of this and know this is a synovial joint. Okay. All right, here's another view. The synovial joint. You have bursa. These are fluid-filled sacs. Here's a meniscus. Okay, provide some padding. Here's a fat pad for more padding. There's a intracapsular ligament. So that's a ligament inside the capsule. It's a muscle tendon, connects muscle to bone. Here's your patella. So those are structures that you should know. All right, so what I want you to do now, work on your exit tickets. I'll come by and spray. And on your way out, you want to look at. So most of you I have had for lecture or will have this after. We'll come back in here during lecture. We'll look at the cadaver or syndaver.